to the Hormone Café. I have a very special guest with me here today. My name is Dr. Sarah Pederson. I am a holistic OB-GYN, and this is our nurse practitioner. Her name's Emily here at Vera Health and Fertility. Emily is a women's health nurse practitioner in our focus of holistic care, and she specializes in regulating cycles holistically, especially empowering women to learn about their cycle, moderate their hormones naturally without needing any medication or alternative treatments, things like that. She specializes in disordered eating, so women who have certain relationships with food and how to optimize that, to optimize your hormones. So we're thrilled, and Emily's particularly relevant because she just had a baby.
Yes.
Sweet Ella. So we thought we would talk about postpartum anxiety and depression because it's such an important topic. The things that we want to go over today are just 5 things that are related to postpartum anxiety and depression. So 1, what is it? How do you know if you have postpartum anxiety and depression? 2, how do you prevent it? And then 4, what are treatment options and how to get help? And then lastly, of course, in our village, we have friends, family. What if you see somebody else that is going through maybe some emotional stages or changes postpartum? How do you help them and how do you approach that?
Yeah.
Those are the things that we just wanted to go over.
Amazing.
But what would you say, what is postpartum anxiety and depression? Because you hear a lot, and it's sometimes synonymous. Sometimes people will say postpartum.
Yeah.
But they don't mean that they just had a baby. They mean that they have postpartum depression.
Totally. Yeah, I feel like postpartum depression is more of what people talk about or you hear about like just with friends and family, social media, which is PPD. You'll see that sometimes as well, or someone had postpartum is what you're saying,
right.
Postpartum depression. Postpartum anxiety is really common as well, but I think of it kind of on a spectrum, like so many things in health and women's health, in that you're going to have emotional changes after having a baby. That's very, very normal, but changes that go beyond just the initial kind of baby blues that most women experience in those first 2-ish weeks, to where you're not able to take care of yourself, others, your baby, you're having thoughts of self-harm, of harming your child, just really more extreme debilitating type symptoms, or, with anxiety, ruminating all the time. I think as new moms, we're always going to Google things. Like I did my fair share of Googling, and that can be really normal, but it can be hard to diagnose or even admit that that's what you're potentially dealing with, because you have to really recognize this is inhibiting my ability to live my normal life. And I feel like that's the big difference between like full-blown anxiety and depression postpartum versus those normal hormonal changes.
Yeah, well, that makes sense. Is it really affecting your ability to function?
Yeah.
But it's hard because postpartum, sometimes you're not functioning perfectly anyway.
It's so hard, but it's so common. I mean, most women, I think it's like 80% are going to experience those like baby blues. Is what they say. The first 2 weeks, just as you have such high like estrogen and progesterone in pregnancy, everything plummets postpartum, and you're getting used to not sleeping, and you have this little life to take care of. It's just so much to transition to.
Yeah, I think it also helps to just focus on your baseline too.
Yeah.
If you're just really constantly changing from your baseline, just always anxious, and you never go down to baseline, or always low and you never kind of come up.
Yeah.
That can be kind of a red flag too.
Absolutely.
So if you are thinking that you might have some of those symptoms, what are some of the things that you can do to prevent it?
Yeah, I think prevention really starts before you even give birth. So in pregnancy, and even before conceiving, ideally, if you are someone who has pre-existing anxiety, depression, or you're just kind of prone to ruminating or worrying, or have had depression in the past, like I mentioned, talking with your women's health provider or PCP about, good self-care habits. If you do need to be on medication, therapy, all of that. But sometimes it just hits women and you weren't expecting it. Maybe you've never struggled with it in your entire life, and just all the changes of pregnancy and postpartum kind of hit you like a truck.
For sure.
Yeah. You can develop it even if you haven't had anxiety and depression beforehand. And so really, really focusing on, I think partner communication is huge. Like something my husband and I spent a lot of time on is figuring out, okay, what are our expectations for the first couple of weeks? Like who's responsible for what task? Who's our support system? What are we going to do if something crazy happens? Like just prevention, I think is key.
That is so true. Yeah.
Tough though.
Is there anything else to do while you're pregnant to kind of help set yourself up for success?
I mean, really the basics, like you were mentioning, like really good sleep, good nutrition, supplementation. I mean, obviously, like if you have a, genetic predisposition for anxiety and depression, like taking your omega-3s isn't necessarily going to completely prevent that. But I know for myself, I feel more anxious if I'm not like eating enough protein, drinking enough water, just those kind of things. So just the basics of having a really good, well-rounded diet, exercise, spiritual and emotional care. It sounds really simple, but those things compounded together make a huge difference.
Yeah, that makes a lot of sense. I think planning too, even postpartum, what you're going to eat.
Yeah.
Who's going to visit you? Who's going to be there?
Who's not going to be there?
That's
who's not going to visit you?
That's huge.
Yeah.
Which mother-in-law is
Yes.
going to be there?
Yes.
I think because I'll feel like a baby is already a huge question mark and unknown, and sometimes that can cause a lot of just anxiety or sadness.
Yeah.
And being able to manage any of those other things can be helpful.
Yeah, like as many variables as you can control. I think that's the best.
Yeah, and being able to make sure you're eating breakfast, lunch, dinner, and getting enough protein and drinking enough water and having your breastfeeding supplies or pumping or whatever kind of ready so that you have all your
Things.
all the things. And that, because I feel like sometimes that can be stressful.
Yeah.
But the partner communication is huge.
Oh, it's so big.
Kind of knowing when, like, dividing and conquering is so big.
Yeah. I know we don't have family in town, but my parents came in for a month and they did all of our grocery shopping, all of our laundry. Like, they would just come in and like put us to work. Sometimes they wouldn't even hold Ella that day. They would just do stuff. And
It's so nice.
it was amazing.
So did you have to talk to them before and kind of set those expectations?
I mean, yes and no. Like, we didn't really know what obviously postpartum would look like. Like, I had a lot of weird physical stuff. Like, I had preeclampsia and anemia and just didn't anticipate how weak I would feel after giving birth, which isn't everyone's story, of course. But I just spent a lot more time in bed than I expected the first 2 weeks. And so I had definitely told my parents, I'm going to be really tired. Like, my mom's had 3 babies. She knows as well. But I definitely talked to them about grocery shopping being helpful and all of that. But also, like, I got induced unexpectedly. And so it all happened really fast. And we just had to rely on our like previous strong relationship to communicate through all of that. So we did talk about it before, but also a lot of it was just kind of last minute figuring it out.
And even maybe just preparing for the unexpected. Yes, you never know if you have to get induced, if you have to have a C-section.
Yeah.
And so that those things just don't take you completely by surprise and cause even more emotions than you kind of anticipated.
I think a lot of this also can tie into birth trauma too, and things not going as you would expect. And of course, you can never fully anticipate and plan for what's going to happen because you just don't know.
Right.
But I think managing expectations around labor, birth, postpartum is really helpful because then you have this freedom of, okay, maybe things aren't going to go great. At least I have thought that that's a possibility and I'm kind of emotionally prepared for that. I do think that is part of the preventative work as well.
That's totally a great point.
It's easier to set
Yeah, it's so true. Yeah. Sometimes if your birth didn't go as well as you planned, you can have a lot of regrets or...
And you're like processing it right after, but you're also exhausted, trying to heal from birth. Family wants to visit baby. It's just a lot at once.
Yeah, that's such a good point. That's true. What do you think about people who are already on depressive or anxiety medications? Like, how do you manage that in pregnancy and postpartum as far as prevention?
Yeah. I mean, that was me. So I'm on anxiety medicine, have been for like 5 or 10 years. Mine didn't change at all in pregnancy because what I was taking is safe in pregnancy. But I think that's just a conversation you want to have. Ideally, preconception, if there's anything that you're on that your provider lets you know isn't safe in pregnancy, if there needs to be a switch. Sometimes you get pregnant unexpectedly and you're on something that needs to be changed. So just being really transparent with your team is good. I mean, I personally, as a provider, personally think that the pregnancy is not the time to like switch things up and like come off meds, especially if you've been stable on something for a long time. But of course, that's just a risks benefits discussion. But even pregnancy itself, like you can be depressed and anxious in pregnancy. It's not just postpartum. So really focusing on your mental health. And, if medication's a part of that plan, incorporating that as well. Just keeping things as consistent and stable as possible because pregnancy and postpartum are so volatile. I think just having a really good game plan and not experimenting while you're pregnant. Like, yes, like it's probably not the time to be like, oh, I'm going to come off anxiety meds, you know, obviously whatever you need to do, but
yeah, my 2 cents. There's and other things you can do to keep your mood as healthy as possible. Love that. Okay, so what if you're postpartum, you're diagnosed with postpartum anxiety and depression? What are the things you should advocate for? What are the different treatment options?
Yeah, and I know we've mentioned medication quite a bit, but you don't have to go on medication, of course. It's just a tool. Some people don't want that, and that's completely fine. I mean, therapy, like cognitive behavioral therapy, DBT, couples therapy, there's so many different modalities out there. And there are a lot of people that we refer to who are specialized in perinatal mood disorders. But yeah, just making sure you talk to your mental health provider, your OB-GYN about all the options, because you can take a more, you know, less invasive approach of supplementation, you know, therapy, lifestyle type things, see if that works. Or maybe you go a little more aggressive and do medication for a bit, get more stable, and then come off of it. There's really 1,000,001 different ways to approach it. It's, you know, I think as... I have to edit that out. I think as medicine becomes more precision focused and patient specific, we're expanding all the possibilities within mental health care, which is something that really excites both of us, you know, mental health wise, but also hormone wise. And so you don't have to be stuck on, you know, just Zoloft or just Lexapro. Like, you can try different things. You can hear about all the options. You can do your own research or bring it to your provider. Like, there's a lot of different ways you can go.
And I think one of our big approaches too is let's start with nutrition.
Yes.
Like, start with the basics. Of course, make sure you're getting enough protein, you're balancing your glucose, make sure you're getting enough fiber.
Yes.
And I think even being able to test your nutrition to see, because if you're missing really specific nutrients, because pregnancy does suck a lot of nutrition out of us, whether that's iron or B vitamins or magnesium, because sometimes just supplementing with that can make night and day difference. Or things like, a lot of times we'll test nutrition, vitamin D, B vitamins. Hormones is huge. Testing hormones, seeing where they are. Thyroid is another big one that we often see. Because if your thyroid is really volatile postpartum, that can make any anxiety or depression much worse.
And it might simply be sleep too. Like, I don't think people realize just how crazy the sleep or lack of sleep can be.
True.
I remember the first 3 weeks, in my opinion, are just complete survival with a baby. And then once a couple months, you know, rolls around, they start sleeping through the night, ideally. And that, honestly, it might just be the cure for anxiety and depression. If that was all that it was, it's usually multiple factors. But sometimes it's something as simple as, wow, I haven't been sleeping enough for 2 months, or I'm not drinking enough water, or protein, not little things, but they seem like quick fixes.
Yeah, but then you out at your life and you're thinking, well, I actually don't really drink enough water, or...
It's crazy. But yeah, all the hormone changes are wild too, like thyroid disorders, you know, having hypothyroidism and feeling just like sluggish and fatigued all the time, or low vitamin D. I mean, it can make a really big difference.
Oh my God. And sleep is big. I remember being at 3 months and just being like a sleep deprived zombie. And I was like, am I depressed? Or am I just tired?
Really tired.
Sometimes it's hard to tease that out.
But
it is helpful to give other people accountability buddies. Like, tell your husband, you're in charge of me drinking water. Or tell your best friend, like, you have to call me every other day. Make sure I eat breakfast. Check in, that kind of thing.
Oh, absolutely. My husband is like my personal chef the first month. It's like, I cannot think about feeding myself. I need you to just give me a plate and I'll eat it and move on.
Yeah, because you're not going to have this bandwidth always to do all these other things.
No. Yeah, it's such a blessing to have people just like step in and help take care of you.
Love that. Yeah. Your village is really important. And then lastly, one thing that we wanted to bring up is, of course, speaking of a village, you know, we all have friends, loved ones, family members, cousins, sisters. Do you have any advice or recommendation if you see someone else who just had a baby and maybe whether they're 2 months or a year postpartum, maybe they're seeming like they're struggling a little bit, but they haven't quite said that they might, or you suspect that they might have some kind of anxiety or depression? How do you approach those friends?
It's really hard. Something I think that's a helpful principle with this, but also just speaking on hard things in other people's life in general, is you have to have access to that person and have essentially like permission to speak into their life. And so I would really caution to only bring this up with someone who is like a family member or a really close friend. And of course, in situations of safety concerns, that's different. But, pointing out something in someone else's life should really be reserved for people who you have intimate relationships with. I will say I have had to do this with people in my life, and it's really hard, especially if you are a mom or not a mom yet and you see a mom struggling. I think there's that tension of, oh, you don't get it. You haven't been through it. And at some level you don't get it, but you also know that person and you care about them and want the best for them. And so I feel like the language of, hey, I've noticed feels less judgmental and like accusatory. And so being like, hey, I really care about you. I've noticed XYZ changing, and I just want to check in and make sure you're okay. And maybe not diagnosing or saying, I think you're struggling with postpartum depression, because you ultimately don't know. Just opening that conversation and space for them to be honest with you, I think is a really good first step.
That's so helpful. Yeah. Sometimes it's hard to bridge that.
Yeah.
And maybe it's not the first time that they're gonna recognize it in themselves, but just knowing that they have you to talk to is huge.
Yeah, and they might shut down and say nope and get defensive and stuff, but at least you've opened that door and they know, okay, maybe they'll think on it a couple days, weeks, months later, and then come back to you and say, hey, actually I am struggling, can I talk to you about it?
That's such a good point about just being accessible, being open. Yeah, that's huge. Well, thank you so much. So thrilled to have you. So today, just in summary, things that we wanted to go over are: what is postpartum anxiety and depression? How do you know if you have it? What are some of the red flags? And then how you prevent it? What are the treatment options and how to get help? And then if we see a friend or family member going through it, what do we do and how do we help that person get help or see something in themselves where they can feel their best possible selves? We work at a clinic called Vera Health and Fertility in Denver, Colorado. If you are worried about you want to prepare yourself to prevent postpartum depression, you had a baby, you want to check your hormones, thyroid, vitamins, talk to us, definitely give us a call. Thank you today for joining us on the Hormone Café. And our next episode is going to be on postpartum self-care. Another important topic. Yes. Thanks, Emily.
Of course.